Good evening, everyone, and welcome to the virtual Family Council meeting. My name is Jamie Rose. I am your virtual meeting coordinator. So we're going to review our confidentiality statement. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. And just a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. So our meeting agenda this evening, we are going to get our virtual meeting tips from Jay, and then we're going to turn it over to our friends at CARIE so they can discuss some of the proposed nursing home regulations and a real call to action for everyone. So, and then we're going to bring it back at the end to just talk about some of our upcoming meeting topics. So without further ado, I'll pass it over to Mr. Rotz.
Thank you, Jamie, and hello, everybody. You've all been placed in mute upon entry. We will open the lines in a bit so that you're able to share. If you would like to speak or have a question, please use the raise hand feature. Once you raise your hand, we'll know to acknowledge you and unmute your line. If you hover your mouse near the bottom of your screen, you will see the participants tab. That can be expanded. Camera icon at the bottom of the screen. You can click on it again to start sharing your camera again. And finally, any concerns or complaints can be directed to me at the State Ombudsman Office. My number is 717-783-8975 or email at capital LTC-ombudsman@pa.gov. And now it is my pleasure and honor to present from CARIE, Diane Menio and Kathy Cubit.
Good evening, everyone. I'm Diane Menio. I believe many of you have met Kathy before, and I know some of you, but not everyone. Again, my name is Diane Menio. I'm the executive director, and you'll see our contact information on that second slide. And please feel free to contact us if you have any questions or concerns. And I also want to say that please feel free to contact CARIE if you ever have any issues that you need help with. And I mean, not in lieu of your own ombudsman, but in terms of other issues. I'll say that, I just want to say that we've been, for those of you who haven't met us before, we've been in business for 45 years now. We're an advocacy organization, and we like to think about what we do as a circle of advocacy. We help people at the individual level. And again, that's with any problem that they might have. And then we have some programs like the Ombudsman program, and one of our participants today, Sheldon, mentioned our Senior Medicare Patrol program, which is a statewide program identifying healthcare fraud. So our mission is to promote the well-being, rights, and autonomy of older adults through advocacy, education, and action. And so that's what we do, and that's part of the reason we're here tonight. When I mentioned our circle of advocacy, we help older adults and their family members, but we also go on to help change policy. And we've been very much involved in policy change during COVID, and we're trying to hold out hope that all of the challenges that you as family members and the residents of facilities will see something different after what they've experienced during COVID. So we continue to advocate, and that's what we're here to talk with you about. You can go to the next one. So I'll talk a little bit about the agenda. We're going to go over the regulations review and talk a little bit about Pennsylvania's regulatory review process and the packages of regulations that you may have heard of before and what's happening now. Then we want to talk a little bit about what you can do to promote the changes that need to happen. to the regulatory process in order to protect people in situations like we've been in over the last two plus years. Next one. So what's happening now is, or what has been happening since last fall, is that the Department of Health has begun releasing the regulations that they want to update on, which has not been updated since the 1990s, so they're well overdue. In fact, you know, the federal regulations have been updated since then, and so there's a real need to do this. And of course, as I mentioned, the quality of care and the life problems that happened during COVID were not necessarily brand new, but COVID has obviously been so deadly and has really intensified this need for change that I think we all have to be concerned about. We can't let this happen again, and we can only hope that our advocacy will help, and we need as many people with us as possible. And so these updates should include those comprehensive improvements. We did a very comprehensive paper, and you'll see the link here. I know you all have access to these slides, and please consider going and looking at that, because they will that will tell you everything about it. It will show you all of the regulations and our recommendations related to the regulations. And so you can go on to the next slide. And so when we shared our recommendations with Pennsylvania's Department of Health, and we know that, you know, they looked at them and they took them seriously. And we saw that happen through the first three releases of regulations, although not perfect. They incorporated a lot of the changes we recommended, which made us feel good. Just to talk a little bit about the process, the regulations are not exactly the law, but they are created as a result of the law, and the penalties can be imposed, fines and other, you know, bans on admissions. There's many different things that can happen as a result of regulations if a provider is not following regulations. I mean, the very basic is that if they have a problem, they may be required to do a plan of correction. So they will be if they have a violation. And so it really is a way to improve care if it's used properly. Pennsylvania has something that is somewhat different than many states, called the Independent Regulatory Review Commission. And that commission reviews all kinds of regulations for everything, including dog catchers and dog groomers and you name it. Anything that needs a regulation in Pennsylvania goes through the IRC, which is short for the Independent Regulatory Review Commission. And this is a long process. I won't go into all the steps in the process, but there are many different parties involved in this, from the legislature and others. And of course, the regulations, when they go to in the initial draft form to the IRC, then there's a comment period. And so that's a 30-day period after they go to the IRC. And then this is the formal review, the review process we're in right now. And it's very different with the way the Department of Health release these, because they're releasing them in 4 parts. But in the end, it will be one regulation, set of regulations. And so that's where it gets a little confusing. But we don't have to be confused today. We're really talking about part 4. And we also want to make the point that all of the regulations as a part 1, 2, 3, 4 will come together and must be approved through the final regulation. Once it gets through all these comment periods, there's no opportunity to change those regulations. The IRC either approves or disapproves. So it's a thumbs up or a thumbs down. And there's no changes allowed. So if they approve, then the regulations go into final form. If they disapprove, the department would have to start over again. So we don't want that to happen. The other thing that I will say is that this whole process has been moving quite quickly. So, but we have a sort of a timeline when you look at the political environment, is that this administration ends at the end of this year. And so there's a real importance that this get done now. So anyway, as I said, this 4 packages has been quite complicated. We'll go on to the next one, and I'll just kind of quickly review what's in each package. Package 1 proposes to adopt the federal requirements for nursing facilities and update definitions, increase the number of direct care hours. And I don't want to give that short shrift. That is one of the most important changes in the regulations, is that we have better care in facilities. There need to be more staff. Anybody here who's a family member or an ombudsman has gone into facilities, you've seen issues with staffing. I can't imagine you haven't, because there just often is not nearly enough staff to be able to provide the care that people need. So that's a very important one. And I have to say, the other issue regarding staff hours is that we are very much supportive of that, as is many other advocacy groups, as well as people who are reside in facilities, as well as family members, and staff themselves who would like to have more help in facilities. But on the other hand, facilities have opposed the requirements that we believe are necessary and may not even be quite enough. But we believe very strongly that staffing should be based on a person-centered amount of hours, not because we know not everyone is the same either. So anyway, going on to package 2, provided provisions that it eliminates provisions that are outdated or duplicative of federal requirements, updates standards for alterations, renovations and construction of facilities, and updates provisions for closing of nursing home facilities. And that's a big issue when a closure happens. It's very disruptive to everybody involved. It's disruptive to the residents, to the families, to the community itself, because once you lose a facility, that community may lose its only resource. And so we really need to be careful about what happens during those closures, how closures are monitored, how the notice goes out to residents and everyone else. And I also want to say that, and this goes throughout here, is that throughout the regulations, the proposed regulations from the Department of Health, there's a lot of times when they want to not repeat the federal regulations. We feel very strongly that that the state in some cases has exceeded the federal regulations, and that's very important. But even if it's a duplication, it's important to have it in the state regulations as well. The third one was updated the requirements for application for licensure and change of ownership. This is really important right now. And so having transparency about ownership, I don't know how many people here have lived in a nursing home or had a family member in a nursing home where if ownership was changed and you didn't find out until later. Even the ombudsman, we don't find out until later. There's really no transparency around this. We think there should be public notice if there's a transfer. We also think that if there's a new owner coming in for the first time, there definitely needs to be more due diligence. We have some bad actors out there who are known bad actors and continue to buy new buy nursing homes. And so that's a serious problem, and we need to have more transparency. We need to have the public have their eye on this so that they can come out and let the department know the issues, because the department may not know all of them. We also believe that the department needs to ask for all this information about not only the provision of services in the state, but also outside of the state and related companies. And so, and package 4, and this is the one we're going to, Kathy's going to talk about in just a minute, proposes change. This is also very critical. It's hard to say any of these sections aren't critical because they all are. It proposes changes to residents' rights and the admission discharge policies and procedures and requirements for nursing services and staff development. And the final form, the Department of Health's goal is to have this in by October 2022 to release all of the packages in final form, which would mean that's when thumbs up, thumbs down happens at IRC. So that's critical. So let me just mention a few things about this fourth package, which Kathy will go into more detail about, which is on the next slide. We are, first of all, very disappointed in the proposed final package. That's on the, you can turn the slide one more. So we're very disappointed with that. We found that many of the recommendations that we made were not included, and some of the important provisions that were already in the regulations were removed from the section, which is really disturbing because there were some things that were in there that were protecting residents that were taken out. And we also believe that the department missed opportunities to make improvements by just overly relying on federal regulations, and of course removing those federal regulations from the Pennsylvania regs. And so that we see as a serious problem, and we'd like to see that change. It's going to take a lot of advocacy to do that. And so I'm going to have Kathy's going to talk next and go over that in much more detail for you so that you'll understand what we're talking about when we say that we're disappointed about this and what we need to see change. So thank you. Kathy will take over from here. And you may not have heard the last of me either. So we'll see.
I see a hand raised. Sheldon, did you want to ask a question? You're muted.
Okay, if I may, Diane, we've gone through 3 years now of the COVID and stuff going on. In these updates, has there been any effort to look back what the lessons were learned during our experience at the nursing facilities? Any lessons learned at those facilities, and try and feed those in, because these regulations don't get changed very often. So
right,
we need somewhere along the line, because there's a lot of stuff that was learned, a lot of stuff that was good or not good. And somewhere along the line, that has to be built in to the regulations.
And I will say that is the lens we used for our recommendations, was to make change that would truly make a change so that this would never happen again. I mean, nice to say that, but we hope that it would never happen again. And so, yes, that's where we started. And as I said earlier, the department really followed along with our recommendations for much of the first 3 releases of the regulations. This fourth one, not so much. And we're very concerned about that. And we're also concerned because we're not the only ones here advocating. It's the ownership is advocating too. And they have different ideas about many of these things than we do. And so that's why we need, and they also have paid lobbyists and people. We don't have paid lobbyists. We have you. And we need you. Everybody here on this call, we need you to help. And we need to show that we are a force to be reckoned with as well. And Kathy will talk more about what you can do. But you're absolutely right. I mean, one of the things that we did on package 3, there are some provisions in there about how to manage, so we talked about, and they did put in that they need to have a clear plan for a pandemic. And so, which is something that hadn't existed before. How are they going to have PPE? How are all these things going to happen? And also we've talked to the Department of Health about having their own plan about how they're going to respond to these things, because it's not just the facilities, it's also the department. And I think that, and I'm going to say this, is that I think that in many ways the government failed in this effort during COVID. And they failed because we isolated people for far too long, who were not able to get the proper care that they needed. Too many people died from COVID and other issues related to COVID, like isolation. And so we have to make sure. And so you're talking to the choir here, I know, and we are definitely with you on this, Sheldon, and you need your help. So I'm going to let Kathy go on to the next slide then. Thanks, Sheldon, for bringing that up.
Thank you, dear.
So as Diane mentioned, I'm going to speak now. This fourth package has a lot of provisions. There's no time to get through even all the sections that are discussed, but we chose a few to review with you today. And top of the list is resident rights. CARIE works with an elder rights framework. And so when we saw, as Diane mentioned, the removal of certain provisions and other recommendations that we made to strengthen residents' rights not included, it really alarmed us. And we hope to mobilize as many people to comment to rectify this situation. So one of the things that was mentioned, but again, I want to reiterate and emphasize, they are, the department's proposing to refer to the federal statute for some of the rights that are included there, instead of keeping a comprehensive list in our, as is now in our current regulations. And why is this important? It's important because when residents are informed and educated about their rights, it's very empowering. And also for family members, when you know these are the rights your loved ones have, you know, this is, you know, something you can fight and hold facilities accountable to. Some other areas where they remove some things, you know, we want to have as many tools in the toolbox, especially for the ombudsman, to help fight and hold providers accountable. So again, this is why this is such a key area that we honed in on and are going to fight for major improvements too. So some of you could see we added a couple of examples of rights that we had hoped would be included. We have a whole list of those in our recommendations. And so again, we can use your support on that. Next slide. So admissions and discharge policies, and certainly this relates to rights as well. Admissions and discharge processes are already major areas of concern, and there's multiple problems. And let's start talking about the admissions process. So when we talk here about discriminatory practices, we're talking about issues certainly related to race, but also related to issues for folks that, you know, may need a lot of care, can be discriminated against in terms of being admitted. People with more advanced stages of dementia may be discriminated against. So these are areas that we are hoping will be better articulated in the regulations so that people will not, when they need nursing facility care, that they will be able to access it. Discharge is already a major problem that I know our ombudsmen are dealing with on a regular basis, as is ombudsman all across the state and country, quite frankly. It's well documented. And unfortunately, and this is again where the regs are so important, a lot of your more unscrupulous providers, they'll just say you have to leave. And if you're not aware of your rights, your discharge rights, people leave, even when they're not ready, and it could end up going to very unsafe situations. So again, we need to improve these protections and awareness And again, this is what we are fighting for. Next slide.
And before you go on, Kathy, I just wanted to say something, and somebody put it in the chat, so I want to mention it, is the other issue we're concerned about is discrimination based on payment. So if somebody is going in with Medicaid, for instance, and if you're a family member and you've called nursing homes asking about admission, you probably will remember that they asked you how much money is involved. And sometimes they'll tell you, they'll ask you and they'll say, well, that's not quite enough, or we don't have a bed. And so, it's something that happens often, and we can see it in the data in some ways as well. So it is a problem. I think the chat moderator put that in there, the facilities cherry pick residents. And of course, many of them do want to bring people in on Medicare. And then, by the way, once they go on Medicare, and this is part of the discharge problem, once they go on off of Medicare and they may need Medicaid, they tell the person that, oh, they have to go elsewhere because we don't have a bed for you. That's not permitted even now. And we have to make sure those kinds of provisions are in the regulations and protect people from not being admitted to the facility of their choice.
And I also see a question in the chat from Patricia, who's saying, are the protections you are advocating for more stringent than the federal law? And yes, in some cases, yes. And states, and including Pennsylvania, can build upon the federal regulations and should in many cases. And you can have regulations that are weaker than the federal requirements, but you certainly can be clearer. You can add more, guidance and information within the regulations, and this is, what we're trying to achieve with our recommendations.
A good example of that is the staffing. The federal regulations do not have staffing ratios.
We also have a couple other comments that are germane in the chat. And both William and Diane are very upset about the closing of the one and only Philadelphia nursing home. But they're also wondering if AARP is aware of, the public comment time for these
Yes.
rules and regulations. And
Yes,
if
and I did put that in the chat that they are one of our advocacy partners, and they're well aware of this, and they are advocating on these issues as well and submitting comments.
Right. And
So
we
Carrie,
did have.
Yeah, I just want to say quickly, part of our advocacy strategy, and you'll see that when you go to our website, we early on in the pandemic, CARIE quickly organized with statewide advocates, and some of you that have been on other webinars, Pam Walls from Community Legal Services is one of our partners. And these statewide disability and aging advocates, including AARP of Pennsylvania, have been working together to formulate comments and again, help with grassroots mobilization.
Great. Now, the first comment in the chat was from Virginia, and it sort of centers around residents' rights and Westmoreland. And she feels that the residents, they don't receive the same rights. Maybe, there's favorites or something like that. I'm reading into it because they don't receive the same treatment for dining and activities. And she's wondering if other people are experiencing that and really what can be done about it.
Well, it's certainly, facilities are not permitted to treat residents differently due to payment source, for instance. So if somebody's in there on private pay, there are things that they can pay for, like a single room, for instance, they might be able to pay for. But in terms of the food, in terms of the basic services of a nursing home, they're required to provide like services. So, but it's challenging, and it's an issue of enforcement. And that's where the ombudsman come in. That's the ombudsman's job, hopefully, to be able to advocate for people not to be discriminated against within a facility. And as you're going out to visit a facility, to be aware of those issues and advocate on them, because there are, it can be challenging sometimes because the law might not be totally clear on that, but but there are those quality of life issues that really need to be people need to have an advocate in order to improve those situations. And again, you know, the Department of Health looks at the regulations as they exist now, both in federal and state regulations, and they will cite based on those regulations. And so if you have something that's sort of in a gray area, it may be a little more challenging, but I do think the ombudsman can be more successful in sometimes handling those cases than a regulator.
We have one more comment, and that Patricia is wondering if the rules for discharge protections are being weakened by these new proposals, by the new phase 4 proposal.
So they are deleting some sections related to discharge and referring to the federal law. So we have made recommendations to actually strengthen the discharge protections. And so in some ways, yes, they are weakening. While they're not completely eliminating discharge protections, they're not adequate as proposed.
Okay, and we have one other comment. Linda Gibson says NAMI might be a mental health advocacy group for discriminatory practices.
And that is a point, that if you have issues, as I mentioned before, often we make a complaint if we can't resolve it at the local level to the regulators. Sometimes that makes sense, sometimes not, but there may be other partners. NAMI, which is the National Association of Mental Health, might be, or there's local mental health advocacy organizations as well as Disability Rights Pennsylvania, for instance. So there are other groups. So it's important not only to look within this small constellation of what exists in the, through the ombudsman and the state Department of Health and Department of Human Services, but also to maybe look beyond and see who the other partners might be. So I think it's a good point. And someone asked if there's still, yes, there's a chance, and let's keep going. So Kathy will tell you what your chance is. So we're going to keep going. Thanks.
The next slide. So other major provision is requirements for nursing services. And this in some ways relates to the first package, which had the most controversial piece of the proposal thus far, in that package number 1 proposed increasing the current Pennsylvania state minimum hours of care a day from 2.7 to 4.1. And again, we had a whole webinar with your virtual family council on this when these regs were released. But this is another opportunity to, in this package, when we talk about how to comment, to re-emphasize the importance. And again, even though the industry is fighting against this increase for various reasons, we are saying this needs to be a base minimum. And this package, it adds to the requirements around nursing services to propose specific ratios of nursing staffing in facilities. And the new regulations are proposing 1 nurse aide per 10 residents, day and evening shifts, and 1 to 15 overnight. They are proposing a minimum of 2 RNs and an LPN per day, and this would be per 60 residents, and 1 RN and 1 LPN during the evening, and 1 RN overnight, again, per 60 residents. So this package adds these important additions to trying to have a minimum. We add in our recommendations that 2 points just to add to this, that it's important that individuals get the care they need. And so when I'm saying the words minimum, some individuals require a lot more care than other residents may require. So every resident should really have get the care they need. Secondly, facilities overall. Some may have a lot of residents that have higher level of needs. So they, therefore, from our point of view, should have even higher staffing levels to make sure, again, residents get the care that they need. So that's, what this is about. The other point here on our slide, people need to know what the actual staffing is from day to day, and we would like to see this information easily available on site as well as online. Next slide. Staff development. These are very challenging jobs. And, this is an area we feel that staff need more support and training, and at the outset when they're starting as well as ongoing. And so we, as you can see here, made some recommendations for additional training, just even around the area of understanding dementia and communicating with people that are living with dementia. These are skills that can really help the worker and improve care. And so we hope that more can be added in this regard. We also know in some cases, even with the current training needs, people are just asked to check off, a form, or here's a brochure. That's not really adequate training from our point of view. It really, people should demonstrate they understood what they were just taught. And, and that means having people that are doing the training that are qualified to do so. Next slide. Some of the other missing provisions from this package, we feel the regulations are long overdue with the rising number of people living with dementia, and those who, most of whom are cared for in their own homes. But when they need to move to a facility, that, it's important that there are certain standards in our point of view in place for dementia care and memory care units. There's units, as you may know, that are marketed as memory care units. And we think there should be certain standards in place for that. We also, as the second bullet point describes, believe there should be requirements around ethics and compliance with these rules and regulations. Diane alluded to earlier, we have owners getting into this business that aren't interested really in providing care as much as they are as being landlords and other areas. So again, we want to address those issues. The state deleted a section on restraints. Again, they referred to the federal regulations, but we have included some recommendations to actually strengthen these, the current regulations. And again, the resident care plan, the same situation there. They also deleted most requirements under the use of outside resources section. And what this is referring to is when a facility needs to contract with either an agency or another vendor for certain services. And we believe that if they need to assume responsibility, that whom they're contracting with is responsible and qualified and are doing what they're supposed to do. We also think that if a facility is not able to, provide something that a resident needs, they should be required to, get through either a vendor, again, and a contracting way to get that service into the facility. Next slide. So this is, I guess maybe I'll pause here, and because now we're moving into, I'm trying to be mindful of time as well. But before we move on to now what you can do, I just want to see if there's any questions that folks have up to now.
Donna commented that even the 1-to-10 ratio of CNAs for one resident she feels strongly that is not enough. And but
I think that we all agree that that's not enough.
Yeah.
And Jamie did say that there are facilities that exceed the 4.1. We have that data available. And we also know that many of them come very close to that. Most of them go over 2.7. If they go under, they're really in bad shape. But so it's already being done. There are some that are as high as 5 or more. So, but they're still complaining about it.
But yeah, we totally agree. And again, that's why we were saying minimum, and it really needs to be based on the needs of each resident as well as the facility overall. What would be an acceptable ratio or hours provided.
well, doesn't their case mix index for medical assistance or Medicaid be based on the acuity level of the residents? So it's really to their advantage to take people that have high needs in order to get that number up. But then they also argue that the reimbursement rate from the state for Medicaid or medical assistance people is too low per day.
Well, I think one area, there is an incredible turnover of staff in nursing facilities. And I think it's in part due to the fact that they do not have the right numbers. For a lot of the people that want to do this job, do it because they really care about people. And if you're put in a position where you you're leaving someone on the toilet because you have someone that just fell out of bed, it causes people to leave. The MA rates, yes, you can make an argument that, especially with COVID, they might not be adequate. But the fact of the matter is, and this again was raised in other packages, there's not real transparency where the money goes to facilities. The people buying nursing homes right now are for-profit companies. They see profit. And unfortunately, where they see profit is where they're taking away from the care of residents. So it's a very complicated, the Medicaid reimbursement situation is complicated, and we certainly support more dollars, but we need to have some assurances it's going to go to care, that it's going to be going to staffing, not to rising rents and shareholders of these for-profit corporations. So again, I don't know if I answered that person's question.
I think you did. Eileen said that in some homes they use licensed staff like LPNs to make up for the lower staffing, such as an LPN who acts as an admission director. So maybe they trade hats. Sometimes the
Well, I
person
think
is
what
in.
they're trying to say is that they may not even be trading hats. They happen to have an LPN on staff and they're counting them as a direct care because they're qualified. Doesn't mean they're providing that direct care. So that, and there is that was one of the arguments of the industry. They wanted to be able to count everybody as staff. So if somebody is providing dietary services or activities, they should be counted. They believe they should be counted in the ratio. We do not agree with that because they're not providing that direct care that people absolutely need. And as family members, you're providing a lot of that care yourselves. So they need more staffing.
Okay, should we move on now to the take action section? Okay, so again, this is where we're hoping you can help. How you can help, number one, is to submit comments, and when we get to the next slide, there'll be more information there, but also to share this information and encourage others to make comments, including residents who may need some help in doing so, that might want to weigh in. I do want to make a point that when you submit comments, they are all posted online. So you can go online and see what everyone submits, and everyone will be able to read anything you submit. So I would not put anything that you do not want public, because they do not cross things out. Whatever you send in gets posted online. So just be aware of that. So some of the points in this package, this is most likely the last opportunity to not only comment on package number 4, which is the first opportunity to do so, but also to comment on all the previous packages. We now have all the puzzle pieces together, so to speak, because this is the fourth and final of how they broke this down. The Independent Regulatory Review Commission did recommend to the Department of Health that they put out some preliminary comprehensive one piece, so all stakeholders could make one final review of comments before it goes to final form. But it's not clear whether or not the department will respond to that and offer that. So we want to make sure that whatever thoughts you have, now is the time to do that. We listed here a number of bullet points to help guide you with your comments. And again, these reflect this package as well as the other packages. And it's also helpful if you can include a personal story or insight from what you observed or experienced to emphasize why this is important. We have here to reach out to local state senators and representatives. If you have relationships with those folks, they are hearing all the time from the nursing home providers. They do not hear from residents and family members as often. So it's also helpful, particularly again, if you have a relationship, that they understand that this is an important point of view, because when this gets to final form, the legislature, there's certain committees that will weigh in on this process. And lastly, here on this slide, there's a website. We'll be posting we'll be posting the comments that we will submit. We're trying to finalize those soon. So you can see, you know, there'll be multiple pages long, lots of detail, and other materials to help advocates, you know, guide them through the comment process. And we will also, once our comments are available, be sharing that information on social media. Next slide. So here is the important details of when and where to submit. It's a hard deadline of June 27th. You can, if they get comments past that date, they will not be considered or factored in. So you want to get your comments in before then. So that's why, one of the reasons to submit through electronically through email. We have the email address here. You could submit to one, either the Department of Health or IRC. They both share the information they receive with each other. So, you know, either way, you can ensure your comments are received. If you had to pick one, I would do the Department of Health. And again, if you mail, especially knowing how mail delays are, you want to really get that in well ahead of that June 27th to make sure that your comments are received. And I think with that, we're nearing the end of our time, and we're glad to take any final questions or comments. Oh, this slide, I'm sorry, I forgot. This is a snapshot of the IRC's webpage that you know, all the comments will get posted and all the relevant information around. They have one for each of the packages, but this is what that looks like. Thank you, I forgot about that slide. Now we can get to your any other questions or comments.
And I wanted to say that we are still working on our comments, and we'll, you know, post them on our website as soon as they're complete. So if you keep checking back to our website, you can see our comments.
Did anyone happen to submit comments on the other packages that you might want to share that experience or thoughts on that with the rest of the group?
I did on the first packet that had to do with staffing, and I did get a letter back actually. So.
Oh, good.
Yeah.
And can you just, hopefully it didn't take you too much time, that this is something that you would encourage people to do?
No, it didn't take much time at all. No. Mm-mm. And maybe we can get some residents this time to.
We have
get
had
involved.
residents, and we're going to continue to work with residents to do that. Patricia was asking about the are the four regulations in jeopardy passing or due to opposition? And I think the answer to that is they will be passed in some, if they pass, they will happen in some form. But there's some push on the other side. And so they may not come out the right way, the same way as we would hope. I suspect that the people who work in the industry aren't going to be happy with everything. And I know we won't be happy with everything that ends up in the final regulations, but we can only try to make that happen, change this before the final regulations. That's our chance right now.
The IRC, in their process, as Diane mentioned earlier, reviews all kinds of topics and from different state agencies in terms of regulations. they have a basic barometer of how they measure regulations. They want to make sure they're legal, that there's the legal authority to issue certain, regulations. They want to make sure there's not undue burden to the entities that are being regulated. They want to know about cost. So those are some of the issues. And during this proposed stage, when you go to IRC's website, the first 3 packages, IRC has issued a letter in response to all the comments that were received for that package. So you can kind of get a sense of where they may have some concerns, and when where the Department of Health, when they come back in final form, is going to have to clean up some of the packages for that final approval stage.
And just so you know that when you look at those comments, and I definitely, in the first package I read almost all the comments. And it was interesting because some of the provider associations had, they worked with facilities that had form letters that were done, and many of them were from residents who were objecting to the staffing requirements. So that's how they try to mobilize people. We have residents who don't want this to happen. And so we need to make sure that when residents are commenting, that they're commenting in their own voice. So that's really why we want residents and we want family members to be commenting on this, because you're in those facilities every day. My mother was in a nursing home, and I know what it was like. Me and other family members did a lot of the care, and because there was never enough staff. And so those are the things you need to talk about, those stories. And again, as Kathy said, you don't have to mention the facility, you don't have to mention a loved one's name, and you shouldn't probably for privacy purposes, but your name will be posted. And so that's another reason not to connect it too closely. But it is important that they hear stories like that. They need to understand what it's like to be in your bed and push that bell and not see anybody for an hour when you have an urgent need to use the bathroom or whatever it is. None of us want to be in that position of being dependent, and to have that happen, to lose your dignity like that is hard. Not to mention more serious issues.
Absolutely. And thank you guys so much for sharing all that information with us. I just wanted to remind everyone, we are going to send out the slides. So don't panic trying to write everything down. We will have those to you in the morning, so you can just be able to click them and get more of the information that Carrie's put together for us. So fantastic. Thank you so much. Definitely
Just
appreciate
in the
it.
2 minutes, Sheldon was asking about the PCH regulations. Are there new ones in the works? Not that we know of currently, although there's been chatter about it over the last several years. I know there was a work group before COVID, but we don't see that happening right now.
We'll keep you posted if we do hear anything, Shelley. No worries.
Thank you, guys. Great presentation. I appreciate that.
Thank you so much. And I'm just going to wrap up real quick here, inviting everybody to our June 28th. So our next meeting is going to be an open forum discussion. So we really want to hear what you all would like us to present at the Virtual Family Council. It's just our little work group. We only have 3 folks on the work group now. So if anybody wants to join the work group, we'd love to have you. But definitely bring your ideas and your opinions to our next meeting. We would love to have you there. And with that, we're still working on the July 12th topic. So maybe we'll kick something out next time. So thank you all for attending. And as always, if you have any specific concerns or complaints, send those over to Jay at the State Ombudsman's office, 717-783-8975, or shoot him an email at ltc-ombudsman@pa.gov, or you can hop over to the Facebook page and talk to me and all the lovely work group folks, and we'll get you an answer as soon as we can. So thank you so much for everyone for attending, and thank you the ladies, Kathy and Diane, as always.
Thank you.
Your expertise is fantastic, and we're so happy to have you on.
Well,
Thank you.
thank you. We appreciate it.
Have a great evening, everyone.
You too.
Bye-bye.
Thank you.
Bye.